talk about brand new procedures that get rid of knee pain completely. Minor procedures. Hi, Dr. Paul Haider, Master Herbalist and Health and Wellness Instructor, going on 36 years now. Let's get the world healthy. 1,300 videos here for you to get healthy with. Let's make the world healthy. Please give me a thumbs up. Please subscribe. Today I want to talk about 3 new procedures that really are important for getting rid of knee pain. If you have knee pain, and especially if you're in your 70s and 80s and you don't want to do a total knee replacement, these are important. And as you get older, it's probably not a good idea to do general anesthesia, because I've known people who have actually passed away because of doing a general anesthesia. In fact, a good friend of mine, and actually 2 of them, were doing a knee replacement and passed during the operation. So these three things may change your life forever, and we'll get right into that now. First of all, here is the knee, the model of the knee, and how it bends like so, and it has the cushion in the middle. And a lot of people have bone on bone in their knees, and they've lost all the cartilage, and they're in terrible, terrible pain. Usually doctors will say, only thing we can do is, total knee replacement. But there are new things now, and I want to go into that. And they started doing the studies way back in the 2007-8 era of time, and they perfected it now. One particular clinic in Arizona does them all the time. The first one is just a denervation. They take and on the knee, on the side, they make a 1-inch little incision, and on both sides, and they use the local injection so you don't have any pain. They go in and snip the nerves that actually cause the pain had to happen in your knee, and then close you back up, and that's it. Unfortunately, the nerves have a sense of where they should be, and they start to regrow. In about a year, or maybe a little less, they start to regrow and attach themselves, and you have the pain back. But they have changed some things also. I'm going into the second one now. The second one is actually to use radiation therapy and pinpoint it in the area where you're getting pain, and it gets rid of some of the blood vessels and the nerves, and some of the blood vessels put out agents which cause the inflammation and the pain, and so that actually kills off that tiny little area. It's a very tiny little area, and that works for a short amount of time, also about a year also. The third way of denervation is to, again with a local, make a small 1-inch incision on both sides, and then come in and cut the nerves, and then they implant them on the muscles on top and bottom to make sure that they don't move again. So they've learned that, if they suture them down on the muscles there, that they don't start growing back into their own natural place, and this seems to last for a long, long time. There you have it, the 3 ways of getting rid of pain. Does it heal the cartilage? No, but you don't have pain. And if you're in your late 70s, 80s, it's probably not a good idea to have a major surgery. Like I said, I have 2 friends that died during a total knee operation. So, but this is a relatively simple way to get rid of this knee pain, and it will be functional too, and really, really does work. There's no doubt about that. I highly recommend it. If you click on show more, all the different articles, there's just a few I put there. There's lots and lots of articles about denervation, and it really does work. One man used to go golfing all the time. He had to give it up because his pain was so bad. He had the last process of the reattaching the nerve to the muscle, and he was out playing golf again in about a week. So it may work for you. Check it out. And you can look up, there is a group in Arizona that does this, and they're teaching doctors to do this. And so check with your, knee doctor and see what he says. And also, they may have somebody that does this procedure at your local hospital or something. If you have something going on, give me a call at 831-869-9119. 831-869-9119. I have a lot of cancer people, a lot of diabetes people right now. We're going to turn around these people and get them going and feeling great again. There's no doubt about it. And we can do that. 4 out of 5 people are coming down with cancer now. 4 out of 5 people coming down with strokes. There's now all kinds of 50% of the people having a fatal heart attack. Let's get healthy. If you want to get healthy for the new year, give me a call at 831-869-9119. Remember God, remember I love you. And a great seer said, shed just one tear and God will wipe away 100 from your eyes. Basically, God is always with you and helping you. Be not afraid. Have great faith. I love you.